Hello, everybody out there. You are tuned in to The Local Lens, the podcast from the Powell County Health Department in Kentucky, Rio, where we go inside our community's experience with the drug epidemic. Our show is coming to you from Stanton, Kentucky, a small town nestled at the foothills of Appalachia. And on this episode, we have got a very special guest for us. If there were a captain for this big old ship of overdose prevention, then this is him. It is Van Ingram, the director of the Kentucky Office of Drug Control Policy. He's been in the position for 18 years and has been working in the field for even longer, so he's gonna spit the wisdom for us. Now, a lot of our interviews are featuring people that have first-hand experience. They have lived entangled with drugs in some kind of way. Either that or their work has put them directly in line with dealing with people that use drugs. This episode is going to be different from those types. And really, what we're doing is looking at a bigger picture. We're looking at the Commonwealth of Kentucky. And keep in the back of your mind, you can also do this for the United States and also for the entire globe. Thank you for tuning in. This is The Local Lens. I'm your host, Nate Brooks. These are our people using our voices, telling our stories, because no one sees it like we do. Introduce yourself, however you see.
Yeah, my name is Van Ingram. I'm Executive Director of the Kentucky Office of Drug Control Policy. Earlier this month, I celebrated 18 years with this office. And prior to that, I spent 24 years with the Maysville, Kentucky Police Department.
So you're finally an adult with this department then?
I think so.
There you go. There you go. And we also have
Leandra Knox, Project Director with Kentucky Rio.
Mr. Ingram is friends with Janelle Brewer, who is the local legend and nonprofit leader of Spark Ministries, which we will tag her episode in the description of this one.
You know, I think Janelle and I probably 5 or 6 years ago started meeting regularly. At that time, Congressman Andy Barr was holding some stakeholder meetings around the state, and I think that's where Janelle and I met.
Okay, yeah. Any words for Janelle?
Yeah, I've got to know Janelle well over the years. She's done some work for us in Casey's Law training around the state, so important that our folks around the state know that Casey's Law exists and how to access that. And Janelle has been a great partner in doing that.
Yeah. And Casey's Law that you've just heard mentioned is a petition that can be filed by a loved one, commonly a family member, to get somebody put into court-ordered treatment or rehab for some extended amount of time. And over the time that Kentucky has appreciated Casey's Law and that Janelle has been working with it, it has saved thousands of lives. Janelle's episode is all about Casey's Law for the most part, so if you want to know more about that, go click on that link. But for now, let's get back to Van. Can I ask you how you got here? Because you came up through the police, but I don't know.
I was chief of police in Maysville, Kentucky in 2004. Then Governor Ernie Fletcher wanted to address addiction in a serious way. Governor Fletcher put together a panel of people from enforcement, prevention and education, and treatment to travel around the state, go to 16 different cities, hear from people there on the ground in the communities, and come back with a series of recommendations. One of the recommendations was that there was a lot of agencies that touched on addiction, but none that was their full-time mission.
Agencies being?
State agencies.
Okay, yeah.
So one of the recommendations from the panel was to form the Office of Drug Control Policy. It was formed, and I was offered the opportunity to come early on and took that opportunity. I retired from the police department and came here.
So this guy has been here for a minute. Let's start working through what he has seen over this time.
The first really major piece of legislation came about 10 years ago in 2012 with House Bill 1 that was at a special session in 2012. Then Governor Steve Beshear called the legislature into session to deal with two issues. One was a transportation budget, and the other was this opioid crisis. At that time, that bill had 14 chapters in it. It was called the Pill Mill Bill. Okay. But only one of those 14 chapters dealt with pill mills. And what the bill was really trying to do is make sure that when a person is being prescribed opioids for chronic pain, which means they're going to be on them a long time, that's a very careful, measured, and deliberate decision between a provider and a patient. That should not be a casual decision. That should not be a decision that's made without discussing the risk versus the reward of that type of prescribing and that type of treatment. And we just felt like it had become far too casual. It had become just the norm. Oh, you have pain, here's some opioids. And we wanted to reduce the size of the funnel, and we did that. Okay. We dropped prescribing significantly in the years that followed 2012 of opioids here in this state.
So we did an episode a few months back with a police officer from the Montgomery County Police Department, Lieutenant Jimmy Daniels, about his experience with the history of law enforcement on the ground with this opioid fight. And he remembers this period as being one where you could say you were pressing down on top and it shoots out the sides. So we limited the one problem, and it gave birth to a brand new one.
Well, actually, if we look at our data, we see this first spike in heroin trafficking in Kentucky in 2010, a couple of years before House Bill 1. But to say that it increased exponentially when House Bill 1 passed is accurate.
Okay.
Heroin did become much more of a go-to drug for those who were already in the throes of opioid addiction. Many of them could no longer access the pills they were used to accessing, and some turned to illicit drugs like heroin on the black market or opioid pills on the black market. So yes, there's always a new trend in this business.
When you start dealing with decision-making in public office and government, you start hearing a lot about unintended consequences. So this might be called one of those. Yes, we limited opioid prescribing, but you gave birth to the heroin rise. And then...
today we find ourselves fighting a drug called fentanyl. Fentanyl is a prescription narcotic, is an end-of-life drug. It's for moderate to severe pain. But what we're seeing on the streets is not from a pharmaceutical company. What we're seeing on the streets are from drug cartels in Mexico and Central America, who are receiving precursor chemicals from China and other countries. They're producing either a powdered fentanyl or a fentanyl made to look like a legitimate pharmaceutical, or lately just seeing some brightly colored pills that the active ingredient is fentanyl. What makes this so difficult is fentanyl is 10 times more potent than heroin. So think about that from a couple of different ways. If you're a drug cartel, if I'm going to have heroin, I have to grow poppies, which means I have to hire farmers to grow the poppies. Now, if you're growing poppies in Mexico, you're going to have to hire somebody to guard the fields so they don't steal your product. And then when it's time to harvest, you have to take what's an agricultural product and go through a process to turn it into a pharmaceutical. It's much easier just to buy chemicals from people in China that want to sell them to you and skip that other step. So we're seeing very little heroin in Kentucky, and I predict it won't be long. We'll see no heroin. Now, here's the other side of that. Think of it logistically. If fentanyl is 10 times more potent than heroin, what used to take 100 pounds of heroin, I can now do with 10 pounds of fentanyl. 1,000 pounds can be reduced to 100 pounds that I can put in a backpack and move across the country. So for that reason, the other reason I described, and I'll give you one more reason, why this is a business model that's not going anywhere. So for $15,000 to $20,000, you can buy a kilo of pure fentanyl. You could take that, and if If you want to create some pills with a milligram to a 1.5 milligram of fentanyl, you could produce about 750,000 to 1 million pills. At $10 to $15 per pill, we're now looking at 750,000 to $1 million profit off a $20,000 investment.
That's steep.
That's not going anywhere.
No.
There's too much money in that.
Yeah. And if it does go anywhere, it'll go to something that's more extreme.
There's no way we're going to arrest our way out of that, because there's always going to be people willing to take that risk for that kind of reward, that kind of money.
That means a lot coming from you, somebody with as extensive of a police background as you have. I'd say a lot of people wouldn't expect somebody from the law enforcement side of things to say that that's not the way out.
Well, that's not to say we don't need law enforcement. We certainly do.
True, yes.
And we certainly need to keep doing what we're doing as much as possible. And certainly we want to impact supply in our communities as much as we can. Mm-hmm. But by the same token, preventing use in the first place, treating individuals with a substance use disorder, and having good recovery supports, one community at a time, is the key, I believe, to ending this addiction epidemic. Mm-hmm. Washington, D.C. will never fix Kentucky's drug problem. They have a part to play. Mm-hmm. They have tools that they can give us. By the same token, Frankfort, Kentucky is never going to fix Stanton, Kentucky's drug problem. That's going to happen in Stanton. That's going to happen in Clay City. That's going to happen in Powell County. Do we have a role to play at the state? Absolutely we do. Do we have tools that we need to provide folks on the ground? Absolutely. Do we have laws that need to be in place? Yes. Do we have funding that we need to help folks access? Yes. But the real change is going to happen at the community level. I can't sit here at a desk in Frankfort and fix any community's drug problem. So it's got to be done by local champions that take up the cause.
What can you give to communities to encourage them on that path, I guess?
Well, we have our Kentucky ASAP boards in every community in Kentucky, and we'll fund them to the tune of $20,000 to $25,000 per year, and then they all have the opportunity to apply for supplemental awards for things like harm reduction and prevention projects and treatment projects in their communities. Right now we're going through the process with Opioid Abatement Commission. Mm-hmm. The Opioid Abatement Commission is going to. So during this last settlement with AmerisourceBergen, McKesson, and Cardinal Health, and Janssen, who we know as Johnson & Johnson, that settlement was $480 million, with $240 going directly to local communities.
Okay.
And then another $240 going to the Opioid Abatement Commission, of which I'm a member, mm-hmm. that will also put money out to communities, groups, and nonprofits throughout the state that have good projects going on. So there's some real dollars fixing to come into this.
Yeah.
Our hope and prayer is communities will do the right thing and spend that money wisely on good projects that will have an impact, not just now but down the road. So there's some rare opportunity here.
Yeah, I mean that's $480 million is. What does this scale of funding actually compare to what our state's seen before?
Well, it's unprecedented. We've never had a settlement anywhere like this, nor I think we probably ever will again. There's some smaller settlements coming with some pharmaceutical, some pharmacies, some retail pharmacies chains. There's potentially another drug manufacturer or two, but I think this will be the largest. Mm-hmm. It's spread out over 18 years, so it's not a total windfall all at one time, which is probably good, mm-hmm. because communities might try something for a year or two and just figure out this is not working, it needs to be tweaked, whatever, and they'll continue to have money coming for a while that they can count on.
Yeah. Because just about no matter how you break down $480 million, it's still a good chunk of money, whatever fraction of that you get.
Yeah, it's still a lot of money, and I'm encouraged by it, and hopeful that communities will make good decisions about how they use these funds.
What do you think are, like, just off the top of your head, some good uses for that money?
Well, we're working on implementing something called recovery-ready communities.
Okay.
This is based on a bill sponsored by Representative Adam Bowling in the 2021 session, signed into law by Governor Andy Beshear, to let communities apply for and receive certification that they are recovery ready.
Mm-hmm.
And what are we talking about there? Well, do you have transitional housing in your community for people as they're coming out of treatment? They got a safe, sober place to live for a while. Do you have second chance employment in your community? Do you have employers that will hire people who are recovering from an opioid addiction, that may have a felony related to that opioid addiction on their record? What about transportation? Has your community thought about helping with transportation needs for people who are trying to get to a treatment program or who are trying to get to a job interview? Child care is another issue for a lot of parenting women recovering from a substance use disorder. So there's a host of things. Do you have things like Celebrate Recovery and AA and NA in your community? So these are the kind of things we're hoping communities will take stock of what they have, and more importantly, what they don't have, mm-hmm. and come up with plans to how to address that. Because we can't sit here in Frankfort and provide transportation for 120 counties.
Yeah.
It's going to take some partnerships at the local level to make that happen.
Transportation in this state that's a tall task.
It is. So a few years ago, we started a pilot here at Office of Drug Control Policy, partnering with the Department of Corrections and the Department for Public Advocacy to use Medicaid non-emergency transport. So in every community in Kentucky, we have to have the ability for people who are on Medicaid to get to an appointment if they have a legitimate transportation need. So we contacted with those providers to work with our people who are on probation, who are on parole, who are in a courtroom, and the judge says, I'll let you go to treatment. How are you going to get there? But we got a way to get them there now.
Yeah.
It's been pretty successful. We've had some pretty good outcomes with that.
Where do they do that? Is this all through the state?
It's all through the state, but like I say, it applies to that narrow population of probation and parolees or people who have an active case in court.
Yeah, okay.
And we need to be thinking about our people in early recovery who are not criminal justice involved, mm-hmm. and how can we get them to the places they need to be until such time. If you get a decent job, then the transportation issue starts to fix itself. Mm-hmm. If you get a decent job, the housing issue starts to fix itself. Mm-hmm. The key is transformational employment, is a job that you can make a living at, and support yourself and your family with.
Yeah. So if you're, Leah.
I was just gonna say, this is a very good example of what Alex Ellswick said.
Yes.
Very similar, because resources are key to everything.
Absolutely.
In recovery.
Absolutely. So allow me to bring you up to speed on who Alex Ellswick is. He is a guy who is in long-term recovery himself, but now holds a PhD from the University of Kentucky and runs a nonprofit in Lexington called Voices of Hope. And that is pretty much an army of peer support specialists. They do incredible work, and if you want to hear Ellswick's story, then we've got the links to his 2 episodes on our show down in the bio of this.
Yeah, and so many people, now Alex will be the first to tell you, he had resources and that helped him work, mm-hmm. and a lot of people don't.
Exactly.
A lot of people get out of treatment or get out of prison and have nothing. Mm-hmm. And many times folks finishing a stay in treatment have burned a lot of bridges and throughout their addiction, and
they call what's familiar.
May not have the family support that a lot of people have, and they come out with little to no money and little to no prospects. Mm. Well, that makes returning to use awful tempting. Yeah. If you feel like there's no chance tomorrow looks better than today, and today wasn't very good.
Yeah.
Mm-hmm.
So those are the things we need to work on.
So let me ask you this then. How excited does it make you to see companies like App Harvest coming out, like providing a lot of employment.
I have been just floored the last couple of years with the business community, how they have stepped up in Kentucky.
Okay.
This office has partnered with the Kentucky Chamber Foundation to run a program called the Kentucky Transformational Employment Program. They've worked with thousands of employers. Last year we had our first Fair Chance Employment Academy. We had over 15 businesses representing over 20,000 employees. We're going to have 3 more of those this year. And we have a waiting list of companies that want to take this training. Look, we got somewhere between 70 and 80,000 unfilled jobs in this state.
Yeah.
We cannot turn our back on people in recovery and people who've had a run-in with the criminal justice system if we're going to fill those jobs.
Yeah.
And I think our business community knows that.
And you certainly know that as somebody with let's talk on your past with law enforcement for a minute. You made the comment earlier that this is not something we're going to arrest our way out of. I guess you've been in office here since drug court has really taken more of a hold. Anything similar to drug court, like how are those impacting the whole picture of the state?
Well, drug court's a great program, and it's been around a long time. But it's a relatively small program because, it's limited as to how many participants can be in it. I mean, but I think for the right individual, it's a great motivator. One of the things that we're going to start trying in January of 2023 is we're piloting a program in 11 counties. This is called Senate Bill 90. It was passed in this last session, sponsored by Senator Westerfield, signed into law by Governor Andy Beshear. And that program, in 11 counties, we're going to identify charges that make you qualify for this program. And it can't be anything violent, it can't be anything sexual, it can't be domestic violence related, it can't be a DUI, but it can be a minor theft, it can be a minor drug charge. And we're going to get you assessed within the first couple days of arrest. And if it determines that you have a behavioral health disorder or a substance use disorder, either one, we can work out a year-long treatment plan for you that includes everything from jobs, skills training, education, treatment, and recovery, and then make that charge go away after you complete that program.
That's huge. Yeah.
So if we can prove over this pilot period that this can be successful, then we can start to move it across the state.
Do you know what 11 counties, like what region that is?
They're all over the state.
Okay.
They're in Letcher County. They're in Greenup County, Davis County. I can't remember all of them off the top of my head.
Yeah, right there you got a good spread already.
But yeah, they're all over the state.
Yeah.
Hopkins. They're in Hopkins County. They're in Christian County.
Yeah.
So yeah, we got a good cross section of the state.
And even with those that you just mentioned, there's a mix of closer to urban versus rural going on there. What does that split look like to you from this office?
Yeah, I mean, we wanted to get some counties that are rural, like Greenup and Letcher, but we had to also be able to show that this could work in an urban environment with Owensboro and Hopkinsville and places that have a little more size to them. Look, this is a pilot, so we need to have a cross section of Kentucky, and I think Administrative Office of the Courts, in choosing these counties, have done that.
Okay, great.
And here's a little bit more on the topic of courts.
We fund 2 programs out of this office. One's called Rocket Docket, and that's where we pay different prosecutors' offices, give them grants, so they can hire someone to kind of be there as people make their initial appearances in court and weed out the more serious cases from the less serious cases.
Okay.
And you can hear Jarrett Rose talking about that, one of our very early episodes on the show. We will link that episodes up in the bio as well.
On the other side of the aisle, we fund alternative sentencing workers that are placed in the public defender's office. So that rocket docket prosecutor and that alternative sentencing worker can put their heads together and say, we've identified that your client has a substance use disorder, has chronic homelessness, has some mental health needs of anxiety and depression, and we found this provider who will see them and take them in, and can we do this and hold this charge for a while and see how he or she does. Because so many times in the criminal justice system, we've not identified the root cause of the problem. We've just tried to punish people and say, now you stop it. Well, if the root cause is a behavioral health disorder, or is chronic homelessness, or is it's a substance use disorder, we're better served to address that on the front end than try to punish our way out of it.
Do you
The
see
courts are getting better and better at doing that. I'm also encouraged, the Administrative Office of the Courts and the Kentucky Supreme Court has launched a mental health and substance use court.
Okay.
So we've put together a huge group of about 70 stakeholders to make recommendations how the court can better be involved, the criminal justice system better be involved with behavioral health and substance use disorder. Address that in a more meaningful way.
Okay. Yeah.
I think, that's the thought I think that's going on in this country and in this state right now is we can't keep doing things the way we've always done them and think it's ever going to get any better.
Yeah.
So we've got to work smarter.
Yeah. And is there? Well, first of all, I do want to say I meant to say this earlier too, that it definitely the pill mill bill was definitely something that achieved its goal. Like I've never heard anybody say that that did not significantly stop like this coming from doctors. I didn't give that its proper praise earlier, but when Kentucky is shaping their whole or our whole response to this, are we taking notes from any specific other states, or are we where are we getting this direction from? Is this from our own people here? Or?
So there is a group of folks for this cabinet, myself, corrections, Cabinet for Health and Family Services, behavioral health, public health. We all meet regularly. All of us have funding sources. All of us know each other's funding sources and what we're spending our money on. So we're always trying to make a unified approach as we work to solve this problem and not work in silos, but work together with the same goals. And we have priority populations that we try to focus on. We focus on, okay, who's at most risk for an overdose? Someone who's already had an overdose is more at risk for an overdose death. Pregnant parenting women is a big population for us. People who are criminal justice involved, as I spoke of extensively here, because they cost the state a lot of money. If we can get them recovered from their substance use disorder, they can start being productive again and not costing the state a lot of money. So we try to keep these populations in mind. Really, other states come to us a lot more than we go to other states.
That's great.
Want to know how'd you get this off the ground? How'd you get that off the ground? I mean, so in 2015, we passed Senate Bill 192 and became the first southern state to allow for syringe service programs. We still have that distinction. We have the most syringe service programs of any state in the country. People in other states ask me all the time, how in the world did you all get that done? We've always had a General Assembly that understands these issues and understands we have to do some things that are not comfortable there for everybody. Mm-hmm. But we got to do things to do everything within our power to reduce the harm that's caused by drug addiction. Yeah. And people sharing needles and giving each other hepatitis C and HIV is just not a good outcome.
No.
So, if we can reduce that by having syringe service programs, then that's what we need to do. And we have. Because we also know that people who are participating in a syringe service program are 5 times more likely to enter treatment. We know that in communities that have those, rates of HIV and hepatitis C spread are always reduced. We also know in communities that have them, accidental needle sticks to first responders go down anywhere from 60 to 65%. So these are just common sense reasons why you do these things, you know?
Yes.
Even though it may feel a little uncomfortable at the beginning.
Yes.
Hear these words and take heed, my people. Syringe exchange programs are actually incredible. They are doing wonders, and if we can just get past the gut reaction against them, then think of all the improvement we'll actually bring to people's lives. So this is a word to all of the people across the state that are opposing these programs still, and across the country even. If you are opposed to a syringe exchange program, ask why. Consider if you trust data, and then try to reform your opinion, because they're good programs. I swear by it. And if you are concerned about political clout, then hear this question and answer.
What is the mood around politics in this issue? It seems like it's very bipartisan across the board, but
I've been here 18 years. There hasn't been any politics.
Okay.
There's not a Republican answer or a Democrat answer
Okay.
to the addiction crisis we're in. Everybody knows that.
Mm-hmm.
I have worked for governors of both parties, and I've worked with members of the General Assembly on bills of both parties. And I always have, and I will as long as I'm here.
Mm-hmm.
There's no room for partisanship in this particular issue, in my opinion.
So while we're talking about controversial Thanksgiving meal topics, here's another one: fentanyl test strips.
There's a lot of controversy around fentanyl test strips right now. I guess, how do we address that issue? I know, like, right now at the Frankfurt, I know they're talking about policy right now, hopefully in legislation, because of the laws, where they date back to, what was it, 1970s in the DEA, where it is...
Yeah, in Kentucky's definition of drug paraphernalia, fentanyl test strips falls into that. I hope that changes. Look, you know, as I described earlier, fentanyl is being disguised as other things. It's being offered up as something different than what it is. If a test strip helps keep somebody stay alive, what is the harm in that? What's the upside in it? Not doing it. So, you know, hopefully that will change. But it's a definition that went all the way back, as you said, to the 70s, when many states have that exact same definition.
Yes.
And like a lot of things, it probably made sense at the time it was written, but it's time to take another look at that.
So in public health especially, the government likes to employ what we call evidence-based practices, and that's just stuff that we have enough data and enough research on to have a pretty good idea that it works, that it's going to be worth using taxpayer money on. That's, in theory, a really good thing, but in practice, it might be a little slow.
You know, so much of this stuff is evolves so fast, and research is so slow.
Mm-hmm.
By the time the research world catches up with fentanyl test strips, it'll be something else.
Yeah.
Now, there is some research about fentanyl test strip use and whether people are actually changing their behaviors if they find fentanyl when they don't expect to. Now, this research is from 2018-2019. It is from a few different places across North America, but it's still a few years old, and in the changing landscape that drugs usually have, that's kind of old. And it's also not the biggest study, but what we found in these studies was that about 39% of the time, people were changing their behavior. So that's at least enough to suggest that people do care about whether there's fentanyl in something that they don't want there to be fentanyl in or not. Now, those changed behaviors can look several different ways. Some people were just not using altogether. Some people used much less. And some people reported using more slowly. Now, all of these are ways to help lower the risk of overdoses. It's not the most convincing data set, for sure, but it's enough of a hint that we might be headed in a good direction with these things.
The healing community study that UK is involved in now, it's just now really taking a deep dive into what works in the communities and what doesn't work. And how long have we been dealing with this? 20 years.
Yeah.
There's just research that never keeps up with what we need to do.
Yeah.
And so, yeah, I mean, it would be nice if we had data on every single thing we try, but we just don't. And the answer is, I'm just going to sit here and wait till somebody can prove this works, or am I going to try it? And hope that it does. When people are dying, they're not interested in your research. They're interested in, can you save my child from dying? Yeah. And I'm going to take a chance to try anything I can to do that.
And I will tell you that that is not the answer you would expect to hear from the government. So Kentucky, as much as our people here like to think we're just behind on everything, we are really ahead of the curve on addressing addiction. And big ups to Kentucky for that. But also, there's a lot of stuff to do. So I'm not in any way saying that we're done. But Kentuckians, be happy. Be proud of us because we're doing a lot of good work here. All right, so now we're almost to the end. So let's look back and see what he has learned over the years. Obviously, we've heard a lot about what he's learned and what he's done, but what are some of the other more abstract lessons?
What has been the most surprising development?
That I still learn stuff every day about this disease.
Yeah.
That I still learn every day about things we need to do, things we don't need to do, how stigmatizing it is, how much misinformation is out there. But yeah, we're on this opioid abatement commission. We've been traveling around the state, and the same problems I heard facing people in Pikeville are the same problems I heard facing people in Louisville, and in Lexington, and in Ashland, and in Hazard. Transportation, childcare, good jobs, all those things came up everywhere we go. Yeah. Housing came up, has come up every time.
Yeah.
And safe, quality housing.
And that's a huge one.
It is.
Yeah, that's. Well, we will all stay tuned to see how the whole housing thing.
Well, I hope the communities will look at that as they get that opioid abatement money.
Do you see the direction that you think our approach needs to be heading in more of? Are there any specific steps that our state or the smaller communities in the state should be taking to be better?
I'll go back to being recovery friendly. When people first leave treatment, they need a lot of support. They need a lot of help. And with the things we've talked about and things we haven't talked about. There's such a stigma that goes with this disease. Stigmatized more than any other disease, for sure. Just the understanding from communities that this is a chronic brain disease that changes the way the brain is wired. And it cannot be fixed overnight. It can't be fixed in 30 days. It takes a lot of time. And people need varying degrees of help during that time. It doesn't mean, transportation forever, but for a while they may need some help with transportation. For a while people may need help with a place to live. For a while people may need help finding a job and being successful in that job. Our hope is that people will provide the same degree of compassion for this disease as they do many others.
Yeah. Let me ask you this. Has there been any times standing out in your mind that you seriously put your foot in your mouth, where you just learned something that floored you, almost embarrassing to learn?
Probably how little understanding I had of this disease when I was policing. When I couldn't just understand why people just couldn't stop.
And that is one of the big reasons why we do this show as a podcast. So we're giving you all, our audience, the opportunity to learn these lessons in private, maybe save some of the embarrassment that always comes when you learn something new. And let me speak for myself on this and say that this is also where I have learned this information too. I want to be sure that you all know that our learning experiences have been the same. I came into running this show without much experience at all in harm reduction or in addiction. So it's been a process. It is a learning process, and we just have to own up that we're all here to learn. We are all here to do better, and that's a good thing.
You know, in law enforcement, the interactions we have with people with a substance use disorder are often some of the worst times in their life. They are not in their best behavior. And so that can be kind of stigmatizing. If the only time you deal with somebody with a substance use disorder, it's a very negative interaction. Where in this role, I get to meet people every day who are in recovery from substance use disorder, who are living good, who've had these struggles but are now in a better place. You don't really see that so much when you're policing.
Yeah. And same for EMS.
EMS, exactly the same.
Yeah.
Our emergency departments and our hospitals, same thing.
Yeah.
You know, so there could be some fatigue out there, some addiction fatigue, and it's understandable. It's not, you know.
Yeah. It's kind of incredible to me that you've been in this for 18 years, because I mean that's a long run of it, I feel like. But I mean,
it is, but there's a lot of work yet to be done.
Yeah. Well, thank you for doing it. I appreciate it. Do you have anything else on your mind? Any final thoughts at all? Any other topics you want to address?
Yeah, I do. I want
Okay,
I want your listeners to understand there is help and there is hope available. 8338-KY-HELP. 8338-KY-HELP. That is the statewide call center. It's a screening and referral service for substance use disorder. It's open 7 days a week. There are compassionate people on the other end of that phone that are screening and referral specialists that are very good at their jobs. And if you or a loved one are suffering with a substance use disorder, that's a resource that's available to you every day of the week. The other resource I'd like to make your listeners aware of is findhelpnowky.org, website that's operated by the Kentucky Injury Prevention Research Center on a grant from the Center for Disease Control. That website is kept up to date on a near daily basis. So when you go to that website and a treatment center says they have availability, then they have availability. So many times we've seen websites built and never updated and never kept up with. This is kept up with every day. So if you're a loved one, a person in addiction, or you're a medical provider that wants to make a referral, if you're a professional agency that wants to make a referral, this is a resource that with a few clicks of a mouse, you can find out what type of treatment's available to you and what if they're a Medicaid provider, if they take private insurance, and where they're located. So 2 great resources the state provides for folks who need them.
And just like that, we're done here. That's all the information we've got for you today, and it is a lot. We would like to extend a huge thank you to Mr. Van Ingram for coming on to the show with us. We do hope that you listeners are taking this as such a big deal that it is, because this guy has been helping direct the efforts of the state for almost 2 decades now at the Office of Drug Control Policy. So we're getting to hear what our state is looking at and what our state is calling important. And our state is widely applauded for doing good at all of this. So take this to heart. It's a lot of topics. Go back over it. I've listened to it about 4 times and am just trying to process all the information that's here. So Big thanks to Mr. Ingram for sharing all your experience and what you know with us. We appreciate it. Thank you, listeners, for coming back for more. Please be sharing this with your friends and family and anybody that you think needs to hear this. Check the bio for a lot more information and other ways you can find help. This is The Local Lens. These are our people using our voices, telling our stories, because no one sees it like we do.